So what are the thyroid replacement options available, and how to choose the one that is best for each individual?
Oh, great question. So thyroid medications, I like to kind of separate it out into two categories. One is natural desiccated thyroid, and then the other is synthetic thyroid medications. Both are fair options, and there's pros and cons of all of these. So I'll try to kind of break down some of that in more detail, but I generally see the most success with natural desiccated thyroid. Not for everybody, but for a good percentage of my patients. And the reason why I think that I'm seeing such good success with natural desiccated thyroid is that it mimics human thyroid production very similarly. And so it has T4 and T3 in it, where a lot of the most common synthetic thyroid medications are T4 only medications. And so I really like natural desiccated thyroids, and that's common medications are Naturethroid or WP thyroid or Armour thyroid or NP thyroid. Those are some of the more common natural desiccated thyroid medications. And then on the synthetic thyroid medication side, the most common hypothyroid medication is levothyroxine, or Synthroid as the brand name. And for many people, they feel just fine on it, but unfortunately a lot of patients, their lab numbers look fine, but they don't feel fine. So and that can be sometimes because their body's not converting well to the T3, because it doesn't have both of them. It's just the T4 only. But anyway, so levothyroxine is one. You can also get T3 and Cytomel. That's the most common synthetic T3 medication. There's Tirosint, which is interesting. It's a T4 only synthetic medication, but it is gluten-free and it is lactose free as well. And they just recently came out with their Tirosint Sol, which is a liquid option as well. So especially like for kids or those that have a hard time swallowing the tablets or capsules, that's an option there as well.
And also for people that don't absorb, right, very well the pills.
Right.
People have gut issues and then absorb it. And also you mentioned something about the other desiccated ones, and they're also hypoallergenic, right? Some people are allergic or sensitive to gluten and lactose and corn and the fillers. Some pills have some fillers, right?
Yeah, and I think I'm glad that you brought that up, because I think that's another reason why some don't do as well on some of the synthetic thyroid medications. And so, again, Naturethroid or WP thyroid. WP thyroid is also made by the same company as Naturethroid, but the inner ingredients are all food-based. So I'll recommend that, especially if someone is having more reactions to the inner and the fillers from especially some of the other medications.